Okay, here's a quick recording. I'm going to play back of a radio station that doctor calls in, a neurosurgeon that has just been to a seminar by the HHS Department of the government, talking to these surgeons about the new neurosurgeon Obamacare program. And this is the best way I knew to share it because I didn't know how to put MP3s on Facebook, so I'm going to put it out here in this, and then I'll put a link to Facebook on it. But anyway, so here it is. It's Mark Levin program, I guess.
All right, let's see. Jeff, Chicago, Illinois. I know you're not listening on WLS because it's tape delayed there, but WLS Country, how are you listening? Or did you just pick up the phone?
Can you hear me?
I can hear you, sir.
Oh, okay. Sorry. Yeah, I'm driving, actually, from Chicago to Detroit. But I heard you talking earlier about the government not knowing how to make pencils, and then you talked about brain surgeons, and I happen to be a brain surgeon. So I found your topic quite interesting, and actually just returned from Washington, D.C., where we were reading over what the Obama health care plan would be for advanced neurosurgery for patients over 70, which we all found quite disturbing because as our population gets older, the majority of our patients are getting over 70 that require stroke therapy or aneurysm therapy. And basically what the document stated was if you're over 70 and you come into an emergency room and you're on government-supported care, that you get comfort care.
And wait a minute. What document and where did you hear? What's the source for this?
This is Obama's new health care plan for advanced neurosurgical care.
And who issued this? HHS?
Yes. And basically, they don't call them patients, they call them units. And they call it ethics panels or ethics committees would get together and meet and decide where the money would go for hospitals and basically for patients over 70 years of age that advanced neurosurgical care was not generally indicated.
So it's generally going to be denied?
Yes, absolutely.
All right, let me ask you this. Is this published? Go ahead.
If someone comes in at 70 years of age with a bleed in their brain, I can promise you I'm not going to get a bunch of administrators together on an ethics panel at 2 in the morning to decide that I'm okay to do surgery.
Let me ask you this. Is this published somewhere where the general public, in other words, a pedestrian like me, can get a hold of it? No?
Not yet.
So this was discussed just with your community of neurosurgeons?
Yes, exactly. The AANS and CNS, American Association of Neurosurgeons, and the Congress of Neurosurgeons, because everybody knows cuts are coming in medicine and reimbursement, and we're the most expensive out of all the fields in medicine, and we're the smallest field. But at 2, 3, 4 in the morning, we're the ones that are in the operating room, and we have to wait for an ethics panel to convene, which are not made of physicians, which are made of administrators, to decide whether a patient should receive our care.
So Sarah Palin was right. We're going to have these death panels, aren't we?
Oh, absolutely. I'm German by heritage, and I read the Rise and Fall of the Third Reich, and basically if they don't call them patients, they call them units. And if you're a unit above a certain age, you get comfort care instead of advanced neurosurgical intervention.
Now, this, you went to a seminar in Washington, D.C.?
Yeah, where a few of my former partners, 2 of them have gone to work for, one is running the VA system and one is head of the Congress of Neurosurgeons out of D.C.
And this information is based, you're certain, on representations and information provided by HHS and other government officials?
Yep.
And when will the rest of us become aware of it? After the election?
Probably. I mean, there's so many things that the government keeps under control that are used in surgery called HUD devices or humanitarian use devices that we're allowed to use now because they haven't undergone full FDA approval. And they're just used in surgery because people know it's the right thing to do, but the government can step in at any time like they did 2 months ago with the device and said, this device hasn't met what we want, and there's no exact criteria, and then they can take it away from us.
And the people telling you what to do, they don't know how to make a pencil, do they?
Oh, exactly. That's what I'm saying. And, we always joke around, it's not brain surgery, but, I did 9 years after medical school and been in training 10 years, and now I have people that don't know a thing about what I'm doing telling me when I can and can't operate.
All right, Jeff, please keep in touch with us. Well, yeah, I have to go, but this was a very, very crucial call. All right, my friend? Thank you. We'll be right back.
Yeah, and what you're going to find is a person who has a stroke or something or an aneurysm that is not operated on, if they don't die, they're going to have to do something with them. They're going to have to get rid of them, because if they survive, they're going to probably sustain 10 times the amount of damage, which is not going to be cheap. And that's what you're going to find with a lot of this organized government health care. They're going to save a nickel and cost us $1 doing it. And I know that because I'm currently on Medicaid. And they cut me off of some asthma medicine that was $100 a month. And I had to go to the emergency room about 6 times over a 5-month period. And every time I go in there, because I have other health complications, it costs about $2,500 every time I go in the ER, even if I just have a cold. So they saved, maybe $400 or $500 on 5 months of medicine, but it cost them about $10,000 in emergency room visits, and they still refused to pay for the medicine. They paid for it for a year, and then they cut me off, and they spent $10,000 on ER visits, and I finally got a lung doctor to find me some other medicine that worked. It's about 6 times more expensive than the medicine I was on. They refused to pay for. So these people are kind of stupid, really. They're morons. They're not going to save us any money. They're going to cost us money. And they're going to have to do something with these patients, because they're sure as hell not going to want to pay for vegetative. Somebody that's in a vegetative state is going to need long-term care. They might live 10 or 15 years and not be able to walk or feed themselves because they didn't get the proper surgery they needed for their stroke or aneurysm. And I don't think they're going to pay for those people. I think they're going to get rid of them. That's what I think. Doesn't make any sense for it to be any other way, but this Obamacare is a bad deal. It's you heard that doctor refer to it as he studied the Third Reich, and it's basically the same health care that Hitler. A lot of these Homeland Security and all these new laws they're passing are basically on the German Third Reich model. And we're basically putting together a new Fourth Reich that's actually is going to control the whole world, the New World Order. And it's going to be a scary time. It's already a scary time. Americans don't have any idea what our lawmakers are doing right now, but I've heard some of the stuff, videos on C-SPAN, and I'm telling you what, some of the laws they're passing right now are just unbelievable. But this is basically going to amount to death panels. You are not going to be able to get approved if you have something like this and you're age 70. There's going to be a lot of other reasons they won't approve you. You may be under age 70, but they may need to convene a panel to decide whether you need heart surgery. And, if it takes them more than 10 minutes to convene this panel and make a decision, you're probably going to be dead, or, here again, you're going to be so much more severely damaged that it'll probably cost them more money than they saved in the first place. But they really get a power trip on denying people care. Even if it costs them more money, they still love to do it. And I'm telling you, it's a bad deal. People need to be aware of what the heck is going on, because when this stuff goes into effect and you find out, I can tell you right now, there's going to be problems, because I know some people that are going to have a life-threatening situation, and they're probably not going to just sit still for. This is setting up a situation where there's going to be some violent confrontations. If you know you're having a life-threatening situation and they refuse to do anything about it. I don't know about you, but I'm not going to sit there and just die for them. So it's going to be a nightmare. It's going to be a nightmare. And that's pretty much all I got to say about it. But people need to complain and keep their eyes open. Thanks.